Good morning. I'm Denise Cundy, Chief Nurse Executive for Unity Point Health Des Moines. Today, I'm urging you to help us slow the spread of COVID-19 in our community, and I'm also asking you to help take care of my healthcare family. I'm so proud to be leading the nursing efforts at Unity Point Health Des Moines. Our frontline healthcare professionals are exceptional, but they're exhausted. They've been dealing with this virus for months. The stress they're experiencing is not just at work. It spills over into their personal life as they continually have to worry that they're going to take the virus home to those they love. Just last week, I spoke with a nurse who was distraught because she had yet to hold her 4-month-old niece because of her fear of passing the virus to her. But like true professionals, they continue to show up each and every day for you, your friends, and your family with no end in sight for the pandemic. As community spread of COVID-19 continues to climb, adequate staffing has become a challenge as an increasing number of our staff are out ill. At the same time, individuals in our community continue to need care for heart attacks, strokes, cancer, car accidents, or even welcoming home a new baby. We need our staff to be healthy, both mentally and physically, to be able to care for all patients in all situations. We need your help now more than ever to slow the spread of this virus. We urge you to take the simple steps that several of us have already outlined on this conference. We know you're tired of hearing about it, but the time to act is now. It's truly up to each one of us to work together to slow the spread. The trend we're currently experiencing can't continue. As Iowans, we pride ourselves on coming together to care for our own. The time is now, and the bottom line is we need help.
This has been a long time, 8 months working with the virus. We are at a really critical point. The hospital, in terms of resources, is stretched thin, and most of the people that are helping take care of these patients have been doing this for months. And fatigue, although it's already in the community, we know you can amplify that in terms of the emotional fatigue that the nurses, the physicians, the staff are all experiencing. I echo everybody that's already spoken and pleading with the public to please be diligent and be courteous, because your actions are also accountable to the health of everybody else. And that includes wearing a mask, washing your hands, distancing, avoiding the happy hours and the social gatherings, because I also feel that of the patients we've seen that have had it, everybody does, like Dr. Gilk said, have one time where they can recognize this is probably where I got it. We've been at this for months. It's felt like we've been running a marathon and we wish we were at the end. And now it's like we're at the end of the marathon and we're looking up at the top of a mountain that we can't see the top of. And it creates a lot of stress at various points in the healthcare system in providing care. And we want to be able to provide the very best care we can, both for our patients that have COVID and patients that need critical care access for other issues such as stroke or heart attack. Everybody continues to need to be treated, and we need the public to help us so we can do that at the level that we want to and the level that's expected of us. So again, as a frontline worker, I worry about my friends, my family, my patients, my colleagues. This is something that will not go away, and we need to flatten the curve. Nothing by itself is going to eliminate this virus. We have to be able to get the numbers under control. Thank you.
We are here today with a very serious message, but I would like to start with actually some positive aspects of where we are today compared to where we were in the beginning of the pandemic. We are in a much better position with regard to PPE. We are in a much better position with regard to testing supplies. We now have ample testing supplies. If you have symptoms, please go get tested so that we can better care for you and your family in knowing who needs to stay home. We also have exciting news on new treatments that are coming down the line, as well as a possible vaccine. Most importantly, we know how to prevent this. It is not inevitable. We have seen evidence of this. We know that the mitigation strategies work. You can see this across different areas. When we do and follow the recommendations, case counts go down, hospitalizations go down, and our community is healthier. Unfortunately, we know that many of us are not following the recommendations. We are frequently diagnosing patients with COVID-19. And I have to tell you, the patients that I'm diagnosing are not surprised by the diagnosis. I have yet to diagnose anyone that cannot give me at least one activity where they might have gotten it. They're relating it back to a happy hour, a barbecue with friends, having family over for large gatherings, getting lax at work in the break rooms. We all have COVID fatigue. It is exhausting to follow the rules, but we can do hard things and we cannot outrun this. There truly is no other option at this point. It very simply comes down to avoiding others. We've learned that the risk of surface transmission, such as touching a surface or handrail that someone with COVID-19 might have touched previously, is not a likely way of getting COVID. It is being within close contact of other humans. If we look closely, we all have something more we can do to help our community, because the dramatic increase in hospitalizations truly affects all of us. One hospital bed taken by someone with COVID-19 is one less hospital bed, less nursing, less physicians, less equipment available for other medical conditions, such as heart attacks, stroke, and many others.
We are amidst the resurgence of COVID-19 across Iowa. The blessing in all of this is that Mercy One Medical Centers, along with Broadlawn Medical Center, Unity Point Health, and the University of Iowa hospitals have been working together to ensure our physicians, nurses, and ancillary staff remain prepared to care for all the patients in need. If everyone recalls where we were in March and the goal was to flatten the curve, we are no longer there. That curve continues to rise, and we are in a critical situation. We have the option to continue to believe this is not an issue or realize the magnitude of our current situation. We are in a crisis across our country and definitely within our state. The hospitals are all working continuously and closely, but I'm now pleading for your help, Iowa. Again, as an ED physician, as a father, as a husband, and as a son, wear a mask, avoid large gatherings, maintain physical distancing, and perform frequent hand washing. Let's flatten this curve. Let us not lose any further lives to this virus. If you haven't already, everyone able should obtain a flu vaccine to maintain your health.